It is 11:32. You are listening to the Mid-Morning Talk on Salam Media with me, Maria Mukwanda. Arthritis means joint inflammation, but the term is used to describe around 200 conditions that affect joints, the tissues that surround the joints, and other connective tissue. It is a rheumatic condition, and to tell us more is Dr. Geramie Nayager. Dr. Geramie, good morning, and thank you for joining me.
Hi, Miriam. Good morning. Thank you for having me on the show.
It's a pleasure. All right, so doctor, please give us more insight and information into what arthritis is.
Thanks. Yeah, so as you said, arthritis, if you break up the word, arth means joints, and then itis refers to inflammation. So as you said, it is the inflammation of the joint space. And when I was called yesterday to say, can you speak on arthritis? I thought to myself, it's such a vast topic with hundreds of different subtypes. So what I decided to do is just narrow it down to two of the most common types of arthritis that we see in society today. And I'd like to just focus and speak to our listeners about those two. So one of the first ones is a type of arthritis called osteoarthritis. And when we look at the word osteo, I'd like to correlate the word overuse, because that's basically what this type of arthritis is. It's the overuse of the joints and the bone spaces. And this we see more predominantly in our older population, our elderly, people who have strenuous work jobs that put pressure on their joints. Um, and yeah, so that's the category of people that are likely at risk for osteoarthritis. So, Mary, when we look at our joints, we've got a bone ending here and a bone ending there. And in
Mm-hmm.
between, we've got a layer of cartilage. Um, so, the purpose of cartilage is to absorb shock and also allow for a frictionless surface between the movement of bones.
Mm-hmm.
And what happens with arthritis, osteoarthritis to be specific, is that we have a degeneration or deterioration of the cartilage in between our joints. And then as a result, we've got two bone ends that are rubbing against each other, causing friction, causing inflammation, and causing pain.
Mm-hmm.
Um, and then on the contrary, we've got rheumatoid arthritis, as you mentioned. That's more an autoimmune issue. And if we look at the word autoimmune, auto refers to oneself, and immune refers to our immune system. So it basically means our immune system is attacking our bodies, specifically our joints.
Mm-hmm.
Um, and we we have inflammation within the synovial capsules, which is the joint spaces, the cartilage spaces. Um, so one is overuse, one is autoimmune.
Mm-hmm.
Both can be genetically predisposed. With rheumatoid arthritis, we tend to see that more commonly in females, predominantly, and also patients who are not elderly, a bit of younger patients. Whereas osteoarthritis, that's more the elderly population, people who are overusing or exerting themselves in the workplace, and all of those.
Mm-hmm. All right, now, what are the most common symptoms for both the rheumatoid and osteoarthritis?
Okay, so with both rheumatoid and osteoarthritis, you're going to get your stiffness, joint stiffness. You're going to
Mm-hmm.
get pain, extreme pain. You're going to be limited in terms of mobility because of the painful joints. But there are some differentiating symptoms between osteoarthritis and rheumatoid arthritis. So I'd like to just point out a few.
Mm-hmm.
So the biggest one is the location. So with osteoarthritis, because it's an overuse arthritis, we're looking at weight-bearing joints. Weight-bearing joints being your lumbar spine, your hips, your knees, um, and also I forgot to mention with overuse, we're looking at overweight population as well. So this is what I mean when I say weight-bearing joints. Joints that are taking the pressure of carrying the body weight. So like I said,
Mhm.
joints. Whereas it's a bit different with rheumatoid arthritis. Rheumatoid arthritis is anywhere between your phalanges in the fingers to your wrists, to your toes, shoulders, knees. And then a differentiating factor between those is that rheumatoid the pain or symptoms on both.
We just lost a sound there. Doctor, we just lost your sound there a bit. Can you please repeat what you just mentioned quickly? Oh, it's still mute. Okay, let us take a quick break and you can sort that out and we will continue when we return.
Received food aid.
Because of you, 2,000 pairs of school shoes made their way to deserving feet. Because of you, we provided access to clean water in South Africa and Asia.
Because of you, we fed over 100,000 people.
Because of you, we can continue to assist people in need and make the world a better place. Thank you.
Thank you.
Your donation is saving lives. www.pennyappeal.org.za. Penny Appeal. Small change, big difference.
What makes Randery Jewelers the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious jewellery? Or is it our master craftsmanship of all your bespoke jewellery needs? We believe it's because at Randery Jewelers, we know just how to make your special moments last forever. Whether it's for a wedding, anniversary, or just a simple gift to show your love, trust Randery Jewelers to make it special. www.randeryjewelers.com. Make your moments last forever with Randery Jewelers, the family name you can trust.
Africa. For your convenience, the Africa Muslims Agency's Durban office has moved to 797 Jan Smuts Highway, Sherwood, Durban. Our friendly staff are eagerly awaiting to receive, advise, and share with you the current ongoing campaigns and projects that you have been supporting for the last 35 years. Visit us at 797 Jan Smuts Highway, Sherwood, or call 031 207 5676. Africa Muslims Agency, inspiring the spirit of giving.
Osman's Taj Mahal Spice and Rice. For over 80 years, Osman's Taj Mahal have been perfecting the art of the perfect blend of spices, pure, aromatic, and well-seasoned. Spices to tantalize your taste buds. From creative cuisines to gastronomical gourmet goodies. From exotic odors to traditional dishes, Osman's Taj Mahal have remained synonymous with quality spices and condiments. Taj Mahal rice, beans, and lentils. Try our range of chili bite mixes, rose and ilachi syrup, our quick and easy biryani pack, and our traditional range of spice blends. Osman's Taj Mahal. There is no substitute for quality.
Every morning on every news flash, I hear the sorrow of the world. It seems like everybody's lost and scared, trying to make sense of it all. And as I travel to and fro, so many faces pass me by. I see lonely hearts living lonely lives, just biding their time. And while we call ourselves civilized, many people living empty lives as they boom their way through day and night. I pray for our world, I pray for every child. I pray for our world to be filled with smiles.
Rejuvenating media day by day. This is Salam Media.
Welcome back. You are listening to the Mid-Morning Talk on Salam Media, and we are talking about arthritis, more specifically rheumatoid and osteoarthritis with the Dr. Geramie Nayager. Doctor, we lost sound there, so we had to take a quick break, but could you please repeat the symptoms that you were talking about when it comes to osteo as well as rheumatoid arthritis?
Sorry about that, Miriam. Like I said, the most differentiating factor between osteo and rheumatoid symptoms is location. So with rheumatoid arthritis, we're going to have bilateral pain and bilateral symptoms, meaning on either both elbows, both knees, both ankles, both wrists. Whereas with osteoarthritis, because it's wear and tear on a specific joint, we're going to have unilateral inflammation and pain. So it could occur on one knee or one elbow or one wrist. It doesn't have to be bilateral. Some of the other differentiating factors between the two is that with rheumatoid, we're going to find that the joints become red, swollen, tender. We call this erythema. You're going to find erythema around the joint spaces, whereas in osteoarthritis, you're not going to find any erythema. And also time of day or time of symptoms. With rheumatoid arthritis, we see that patients normally wake up in the morning, and that's when symptoms are most severe or stiffness is most severe. And this could persist more than an hour after waking up in the morning. And then as you go on with your day, it gradually gets better towards the afternoon or the evening. It gets better with movement and mobility. And it's quite the opposite with osteoarthritis, in that when you wake up in the morning, you are going to have stiffness, usually lasting less than 30 minutes. And then because it's overuse arthritis, as you go on with your daily activities, pain and symptoms get worse through the day and worsen at night or towards the evening.
Well, how is arthritis diagnosed?
Okay, so osteoarthritis is more of a clinical diagnosis based on signs and symptoms and history taken from the patient. Rheumatoid arthritis, however, is diagnosed more on laboratory findings. So there's a specific blood test that we do, and we look at the rheumatoid factor specifically. And an elevated rheumatoid factor indicates severity of rheumatoid arthritis.
So, what are you looking for when you're diagnosing, especially rheumatoid arthritis? And I asked this specifically because a friend of mine was not sure what she had until she realized that after some tests it was rheumatoid arthritis.
Okay, so autoimmune diseases are an umbrella of diseases. Rheumatoid arthritis is just one of them. So when you look at autoimmune issues, you're looking at brittle bones, joint pain, easily bruising, alopecia, which is hair loss, um, a whole array of symptoms. And when you're getting a whole lot of joint pains accompanied by other autoimmune issues, then you're most inclined to go to your doctor and he will then do an autoimmune profile. And then specifically test for rheumatoid arthritis, which is testing for RF. And based on that RF diagnostic lab value, you'll be able to tell whether you do have rheumatoid arthritis or not. Having a normal rheumatoid arthritis and joint pain could be indicative of a different type of arthritis. It doesn't exclude having arthritis at all. Rheumatoid arthritis, however, specifically depends on the RF factor.
All right. What lifestyle changes can help people with arthritis?
Okay, so lifestyle changes affects more the osteoarthritis group because we're looking at changes in your diet, changes in your daily activity, losing weight, so you could alleviate the pressure on the bones. Also, something that most people don't know of is something called uh, physical activity, like physiotherapy and all of that, in which they actually teach you how to use your bones correctly to not put as much pressure on the bones as you would. Um, as far as lifestyle changes in terms of rheumatoid arthritis, due to the fact that it's autoimmune, it's
Mm-hmm.
there's not much you can change in your diet that's going to alleviate the symptoms. It has to be treated medically via medication, and this is done via a specific drug group called disease-modifying drugs.
Mm-hmm.
And specifically for rheumatoid arthritis, what disease modifying drugs, this group of drugs does, is that it preserves the integrity of the joint spaces and the bones. And then we're also looking at anti inflammatories, steroids, a group of over the counter drugs that go by the name of NSAIDs, um, and analgesics. However, it's important to consult with your doctor because a lot of these medications have side effects, and especially anti-inflammatories. Because with rheumatoid arthritis, what medication is doing is suppressing your immune system so that we can decrease inflammation because the inflammation is due to an immune response. And with that, you're at risk of other infections, you're at risk of contracting other illnesses because your immune system is suppressed. And also people with ulcers taking anti-inflammatory, that can be aggravated. So it's important to consult with your doctor. Then you do get your rare cases of very severe arthritis, which can be treated with steroid injections into the joint spaces. This helps as a cushion between the joints and lasts for about 3 to 6 months. And then in extremely severe cases, uh, you may have heard the term knee replacement or hip replacement.
Mm-hmm.
Those are physical options.
Mm-hmm. So, is there no known cure for arthritis?
Arthritis, both rheumatoid, both osteoarthritis, they are chronic conditions,
Mm.
unfortunately. So, as far as my knowledge goes, there isn't a cure as per se. Symptoms can be managed in terms of keeping the inflammation.
All right. So, and there's, I'd like a doctor to tell us if this is a fact or uh, a misconception. People always talk about using too much water and that it will cause arthritis and stuff. So don't wash too much with your hands, etc. Is it a fact or it's just misconception?
I would say that is a massive misconception. Uh, you know, our oldies have these conspiracy theories about everything. And I think if we believe each of them, we'll all be sitting at home in a little box because we're not allowed to do a lot of things. But if you think about the medical side of things, I think it's a big misconception. Wear and tear has nothing to do with the amount of water you put on your hands.
Hey, yeah, people will use that as an excuse to buy dishwashers and washing machines. But anyways,
Maybe that's an excuse for the younger girls trying to get out of washing dishes.
perhaps, yeah. All right. So, going forward, what's the long-term outlook for people with arthritis?
Arthritis is definitely a very severe issue.
Mm-hmm.
And the reality of the arthritis is that it affects your quality of life because you're restricted in terms of mobility. And the pain, especially in rheumatoid arthritis, can be extreme and unbearable. And you find a lot of people, especially younger folk, who are restricted in terms of daily activities, tend to fall under depression due to this fact. So, arthritis doesn't just stop at bone inflammation or bone pain. It's
Mm-hmm.
quite a serious issue. Um, and, if we had more time, it would be nice to dive into the many other different types of arthritis. But yeah, first thing is to consult your doctor. Don't be Dr. Google. Don't Google your symptoms and try to diagnose yourself. The most important thing is get to a doctor, let him or her diagnose you properly and put you on a good treatment plan. Something that's gonna have less side effects. Also take into consideration, as I mentioned, anti-inflammatories may aggravate ulcers. Um, Dr. Googles are not going to know all of this. So trust your doctor, get advice from him. It is a chronic condition. So it's not a one-time fix that you can get from the pharmacy and treat by yourself. Better get it managed properly by a medical professional, and it will improve the quality of life moving forward.
All right, now just quickly on that note, if you are not sure what treatment will work for you, is it possible that other treatments could aggravate the arthritis, especially if it's a rheumatoid arthritis?
Very rarely, but it's not impossible. That's solely dependent, and it's diving deeply into autoimmune issues. And
All
that's a
right.
whole other topic on its own. It's not impossible, but it's quite rare.
All right, so, Doctor, thank you so much for your time and for giving us more information and insight into both rheumatoid and osteoarthritis. And I think, like you mentioned, we should discuss the other types of arthritis and autoimmune diseases.
Definitely. Thank you so much for the platform, Mariam. It was nice having a chat with you.
It's a pleasure. Have a wonderful day.
You too. Thanks.
Dr. Geramie Nayager, taking us through arthritis. If you have been experiencing some form of pain in your joints, if you've been getting some inflammation here and there, do get it checked out. And like Doctor said, don't self-diagnose, don't consult Dr. Google, even though the idea might sound great at the time, but don't do that because Google is not a professional. They will just give you a whole lot of information that is available from different sites. So a great place to start is at your local GP, your local clinic. Get some more information there, get some tests done, and they will then send you to a specialist if need be. And what we've also gathered here is that too much water use does not cause arthritis. So if you're one of those people who are like, I'm not going to do that because arthritis, no, relax, it doesn't. And rheumatoid arthritis is also immune. It's like one of those other autoimmune diseases like lupus and alopecia. So, and it is chronic, unfortunately. It is something that you are going to have to live with, but it can be managed. So, like I said, consult your doctor if you are experiencing any pain or inflammation in your joints. All right, do stay with us. We are going to take a break and we'll be right back.